Hear your views. You can SMS at any time during the show. Type Spectrum, leave a space, type in your contribution and name, then send it to 7197. Your views, our interviews on Spectrum, Radio 1 FM 90.
A very warm welcome. This is Spectrum on Radio 1. My name is Edmond, Kizito, your host. On Spectrum tonight, Uganda at 50. What are the key human rights issues that are looking at findings of the Uganda Human Rights Commission in its latest report? 2 weeks ago, the Uganda Human Rights Commission released its 14th annual report detailing the human rights situation in the past 1 year and also forecasting challenges that lie ahead. This report assesses the human rights violations in the country, ranging from those perpetrated by individuals and those committed by state agencies such as the police, the army, and the prisons service. The report also looks at some critical issues touching on governance in the country, the right to health, and Uganda's international obligations that are not fulfilled. It also looks at some proposed pieces of legislation, including the Public Order Management Bill, proposing what needs to be done to manage public order in the absence of such a law. The report also looks at how government has complied with recommendations of the Commission in the past, especially the challenge of compensating victims of violations. As the debate on this report continues, some state agencies implicated have rejected this report, saying it's biased, but the Commission has insisted that its findings are justifiable. Now, last week on Spectrum, we handled some aspects of Chapter 6 of this report, especially the freedom of expression and media, as we commemorated the World Press Freedom Day. So tonight we will focus on other selected chapters to try and understand the position of the Commission and the implications of the findings, plus other cross-cutting issues that the Commission is concerned about. Our guests tonight, Mrs. Roselyn Karugonjo Ssegawa, Director Monitoring and Inspections at the Uganda Human Rights Commission. You're most welcome, Roselyn.
Thank you, Edmond, and hello to the viewers and listeners.
Viewers, because we're also on the internet. We're also joined by Ms. Patricia Nduru, Head of the Right to Health Unit at the Commission. You're most welcome, Patricia.
Thank you, Edmond. Good evening, everyone.
Roselyn, could you give us an overview of this report?
The report covers plenty of topics, as you highlighted. It's about complaints management of the Uganda Human Rights Commission, the conditions in places of detention, our human rights education activities, our finance and admin. We talk about elections, how we perceived them. We talk about freedom of assembly and expression, and for this purpose we'll be talking about especially freedom of assembly, the UHRC position on the Public Order Management Bill. We'll discuss the human rights concerns arising out of disasters such as lightning, floods, Bududa landslides, and fire outbreaks. We'll talk about health, right to adequate housing, a budget analysis in regard to health, education, and housing. We'll talk about, it talks about Uganda's universal periodic review and the recommendations that were made by other states. And finally, talk about how far government has complied with Uganda Human Rights Commission recommendations.
All right, let's start by talking about this freedom of assembly. You are opposed to the Public Order Management Bill, but which government can run without a law?
For the record, the Uganda Human Rights Commission is not opposed to a law. We would, of course, welcome that kind of law on public order management. However, we believe that that kind of bill should facilitate rather than hinder public demonstrations. In particular, we found that the Public Order Management Bill had the potential to violate rights to freedom of expression, assembly, and demonstrations, among others. So our appeal, and we examine each section by section of the proposed bill, is to recommend that the bill should aim at facilitating rather than prohibiting, which is the current spirit of the bill in its form, and if there are to be any prohibitions on demonstrations, it should be in conformity with the law, in line with the principles of a democratic society. And we appealed to Parliament to review the bill and address the various human rights concerns that we raise. We would prefer that the bill is founded on the UHRC guidelines on public demonstrations, which we developed in a more consultative manner, and those should be the foundation of the law. And in the middle of the report, right after the chapter on elections, just before we talk about our position and freedom of assembly, we published the guidelines again in the middle of the report. So
the government can simply pick it up.
Yes.
From there, we'll come back to that specific bill later, proposed bill. But first of all, Patricia, talk to us when you talk about human rights implications arising from floods, landslides, and market fire outbreaks. Explain that to us. The government doesn't start these fires; it doesn't bring the flood.
Well, we won't say that the government starts them. What we look at are the human rights concerns that rise out of these disasters, as we'd call them, because they have a high human and material and economic impact on people. So if we, in 2011, we looked at specific disasters, and that included lightning because of the impact it had on health, it had on education, the right to a clean and healthy environment. But we also look at the government interventions to each of these, and we noticed there were campaigns conducted, inspection exercises, etc. We look at floods because obviously we all know the impact of floods, and people lost property, lives were lost, and we also point out government interventions, the place where these floods were, and we also narrowed down to the Bududa landslides, which we had covered in the previous report because of the impact on property, food, shelter, and life. We point out government interventions and fire outbreaks in the markets, and this was of great interest in 2011 because of quite a number of fire outbreaks. People lost property, and we make recommendations. We note government interventions and make recommendations. And quickly, the Commission recommends that we should have a disaster preparedness and disaster management commission. Budget allocations should be increased. More coordination with Office of the Prime Minister, Ministry of Works, what they should get involved in form of constructing building, expert supervision, and most especially the Uganda Police should publish a report of the Commission of Inquiry into the fire outbreaks in the markets. That's a general overview of the topic.
Okay, I would like you to talk to us about the right to health and right to other things, but later. Roselyn, could you talk to us about complaints management? That's an important part of your report. What do you mean by complaints management?
Complaints management is the way we handle complaints at the Commission. It's a long process. It entails receipt of complaints, investigations of complaints, resolution of complaints, and this can include mediation and arbitration or the tribunal. So in terms of complaints, we received a total of 1,021 new complaints, which was an increase from 28% from 2010, and the report shows what we have been receiving over the past few years. And in terms of the nature of the top 5 complaints, it was torture, cruel, inhuman and degrading treatment or punishment that took the first position. The second number of complaints largely came on child maintenance. The third was on detention beyond 48 hours before being brought to court. The fourth was on deprivation of property. There were complaints about deprivation of life, and those were some of the top complaints. Other complaints included denial of just and fair treatment in administrative decisions, discrimination on grounds of sex, disability, religion and HIV and AIDS, violation of the right to privacy, violation of the right to health, and complaints were mostly by adults who came in at 96.9%, and children were 3.1%. And in terms of complaints by gender, there were more male complainants than female complainants.
To what extent, the male-female ratio?
It's not a very bad figure. It's about a second. Let me cross-check.
52-48 thereabouts, or is it lopsided? It's alright. We'll get it later. Figure.
But the complaints from men are just slightly more than those from
women.
Only
slightly more.
Yeah, slightly more. It's not very grave.
Well, listeners, this is Spectrum on Radio 1. Tonight, Uganda at 50. What other key human rights issues? Looking at findings of the Uganda Human Rights Commission in its latest report. Our guests, Mrs. Roselyn Karugonjo Ssegawa, Director of Monitoring and Inspections at the Uganda Human Rights Commission. That's a government body mandated to overview the human rights situation in the country. And Ms. Patricia Nduru, the head of the Right to Health Unit at the same commission. Patricia, the right to health, what do you mean by that?
I think we need to make a small correction. We're not a government body, per se. We're a constitutional body.
A constitutional body.
Yes, so it's a constitution our mandate is under the constitution. So.
All right, okay. Talk to us about health. We'll argue about those another time.
Right to health, I think, is economic. We've covered economic, social, and cultural rights, but economically, what's the right to health? It's the highest attainable standard of health, mental and physical health. So that is what it entails, and it encompasses different issues and looks at different conditions which can lead to a healthy life. But we also look at determinants of health like food, water. You can't say that you're healthy when your water system is polluted. So those are determinants of health. You have elements which you use to evaluate the right to health. Is it available? Are health facilities available? Are they accessible? Are they is the quality and are they acceptable to people in the community? So basically, that's the right to health in a nutshell. The Commission received 21 complaints in regards to the right to health. We monitored 194 health facilities, so there's a criteria that we use to monitor. So we'll go out and say, were there facilities in this area? If they were they accessible to people with disability? Were they economically accessible? Could people pay for them? What was the quality of services being delivered in those facilities? And are they acceptable to the people? The community can set up a health facility, but people prefer using maybe their traditional, midwives and doctors. So that is, that's the criteria used. We notice positive developments, building and renovation of health facilities, capacity building, community outreach programs. However, we noted the current challenges, including budgetary allocations, the health sector.
Very little money.
Yes. Inaccessibility of health services, and that is the distance is supposed to be 5 kilometers, somewhere way beyond that, and people can't easily access those facilities. Remuneration and welfare, everyone knows that many of there's an inadequate remuneration and welfare. Some we found in some health facilities, some people earn 90,000 shillings.
90,000 every day?
Every month, not every day, every month. Inadequate staffing levels, you find maybe there's no doctor, so different medical professions have to combine duties. Poor working conditions, that was across the health centers monitored.
Right.
We have issues with communicable diseases, malaria, tuberculosis. There is a phenomenon where there is drug-resistant TB. So that is an issue. The quality, there's escalation of the nodding disease now
in the north.
Yes, in northern Uganda. Non-communicable diseases like cancer are getting a rising. There's a rise in that, and they need to be addressed. Cancer, burden of maternal mortality was high. Child mortality rate was high. Neglected tropical diseases. Many people tell us, what's that? Those are things like elephantiasis. Those are diseases that affect the poor of the poor, the vulnerable.
Right.
Those are the main areas. We make recommendations, obviously budget allocations, prioritize neglected tropical diseases like elephantiasis, filling up those professional gaps, paying people better, ambulances, all that hardware is missing. So the recommendations go around that.
Okay.
Thank you.
Roselyn, could you talk to us about the conditions in the places of detention? We thought they had improved.
Of course, we noted some positive developments. We visited 900 places of detention. These included police stations, police posts, prisons, a few military places of detention, and remand homes where juvenile delinquents are kept. In terms of positive developments, we noted that The recruitment of police officers and prison warders improved their ratio. Of course, the increase is still below the UN standards. These ratios are important because they enhance the rights of suspects. If the police are or prisons are dealing with too many people, then chances of violations are high. We noticed that there was a strengthening of the professional standards unit of the police, which is commendable. We noted a slight reduction in the number of inmates on remand. However, the situation is still appalling because in some prisons we found over 70% of inmates on remand, and this was the case in Arua, Kiruhura, Saza, Rukungiri and Nyabuhikie prisons, among others. We were happy to note the construction and renovation of infrastructure because this would improve the housing and accommodation of the inmates. We noted on a positive note the continued establishment of the human rights and disciplinary committees in prisons, the phasing out of the use of buckets for toilets, the acquisition and enhancement of skills and freedom of worship, among others. But we are really concerned about the overcrowding in dilapidated buildings, cases of long detention, including of those with mental disabilities, which was really disturbing. Persons with mental disabilities are detained, awaiting ministers' orders. There's detention of civil debtors, which is contrary to international law. You're not supposed to imprison somebody for failure to fulfill a contractual obligation.
Or failure to pay a debt.
Yes, yes.
Internationally, it's not allowed.
No, it's not allowed.
But here they do it every day.
It is done, and it's allowed within our law, so the law needs to change there. We were disturbed by the persistence of torture and ill treatment, the overworking of inmates. We found cases of inmates without files. We found children being incarcerated with adults in certain places, and we found that the remand homes that exist have inadequate facilities for health, transportation, food, and for rehabilitation of the children in general. We found that mothers incarcerated with their children face different challenges. Of course, prison is not the best place to raise a child.
Yes.
There was inadequate provision, food, bedding, and clothing for detainees, and of course that also affects the children. We found an increasing number of inmates living with HIV and AIDS, and sometimes access to ARVs and adequate food for these kinds of prisoners is a challenge. Health and sanitation is a big issue. We found in some instances female inmates sharing facilities with male inmates, and we found
female inmates sharing facilities. Where does that happen?
We found it also surprising, but they were sharing facilities, which is prohibited.
Right.
In some places, not everywhere. It was not a common finding, but it was only in some few places. And then we found that the working conditions of the Uganda Police Force and the Uganda Prison Service affects the rights of suspects when they lack fuel, because now they had we found new developments that they had motorcycles and they had some cars, but they were saying now we have no fuel. So that inevitably causes delays. We found the suspects in the few military detention places that we went to. We found problems with them being brought to court. They took way beyond 48 hours, and for some of them a month or so.
Right.
Those were some of the key findings, and of course we make appropriate recommendations.
Let's talk about compensation. How far has this government handled compensation to people who are supposed to be paid for wrongs done to them?
Compensation has been a challenge for quite a while, as you know, and we have never hidden it. We highlight it. The bill, the awards that should be paid to
businessmen,
to people whose rights have been violated have actually accumulated.
How much? What's the total?
Approximately, I will approximate it at about 3.569054,974 billion.
3 billion shillings.
Approximately.
One man took 160 billion. Maybe you didn't hear about it. How many people are these two talking about?
We are talking about complainants that have
How
been,
many people?
Yes.
There are several. The list we have.
Roughly.
We have a
20 or
list
30 or what? More than that?
No, there are definitely more than that.
About
For
100.
Over 100. There are
300 people.
Mark you, we are talking about complainants from way back, as far back as 2003.
One man gets
2011.
and 300 people can't get 3 billion.
Of course.
Is that happening in this country in this age? One man gets 160 billion. 300 men cannot get 3 billion by the same government.
We were happy to note that at least the Legal and Parliamentary Affairs Committee today, we had Honorable Stephen Tashovia demanding that this 4 billion be appropriated and paid to the victims of human rights violations. If this is done, it will be a great thing.
Alright, well, we're going for a break. This is Spectrum on Radio 1 tonight. We're looking at the key findings of the Human Rights Commission in its latest report. We're going for a break. We'll be back to stay tuned.
Wait, turn off the music. Guys, please, no like cows. My wife is calling and I told her I was going to the farm.
Honey, how is the farm?
The farm is very fine.
And the cows?
You can hear they're grazing.
Well, next time tell them to eat grass and not beer. I'm seated behind you.
Hi, honey.
Unlike humans, structures built with Hima cement don't lie. Different types of projects require different cement. We offer the widest range of cement products in the market and are most preferred by all kinds of builders. So if you're thinking about building, think Hima cement. Hima cement, part of you from the start.
John, Mike and I, we go back a bit. We knew John at the beginning, working for someone else. But he was different. He had vision, saw opportunities. He started working towards his goal, opened his own garage, and worked, learning the hard way. His reputation spread. Trust, consistency, quality. Soon people were coming to him from all parts. He made himself and his whole street prosper, and also helped friends, seeing potential in people and helping them on. But John never shouts about all his success. He's just who he is. Special.
So here's to men like John, who make a difference, who enjoy Nile Special, the rich, satisfying taste from the source. Nile Special. You've earned it.
Not for sale to persons under 18.
Spectrum on Radio 1 FM 90.
Welcome back on Spectrum tonight. Uganda at 50. What other key human rights issues? Looking at the findings of the Uganda Human Rights Commission. In its latest report, our guest, Mrs. Roselyn Karugonjo Ssegawa, Director Monitoring and Inspections at the Uganda Human Rights Commission, and Miss Patricia Nduru, the head of the Right to Health Unit at the Commission. You two will be able to call in and contribute to this discussion. Just before we went for the break, you spoke about compensation. Some 300 people need 3 billion shillings over a period of
we're talking
10 years.
Cumulatively about 16 years.
16 years?
Yes. Because now we would like to also add, because we don't want to leave the ones who were awarded last year. So up to current, it would come to about 4 billion Uganda.
4 billion shillings?
Yes.
Demanded for 16 years?
Yes.
And they can't get it. And this is 300 people?
Some have got bits and pieces, some haven't yet got anything.
And they line up, they come from the countryside to come and demand this money in Kampala, and they can't get it.
And they haven't yet got it. It's important.
Let's talk about more comfortable things. Let's leave the things that give us goose pimples. How is the government faring in its international obligations?
According to its peers, they noted some positive developments regarding the government. For example, the government of Uganda, during the last Universal Periodic Review, which every country goes through every is it every 2 years? Every 3 years. On 11th October 2011, Uganda was reviewed, and Uganda was commended for being party and domesticating international human rights instruments, for cooperating with different regional bodies, for having an institution, accredited national human rights institutions such as the Uganda Human Rights Commission. They commended the progressive realization of economic, social and cultural rights. However, delegations, and these are delegations from other countries, were concerned about the existence of the death penalty, the use of excessive force by security authorities, the lack of a law criminalizing torture, and hopefully this can be should be addressed if the president assents to the bill that was passed by Parliament prohibiting and preventing torture. Delegations expressed concern about the exercise of the freedom of assembly and association, and Uganda also made voluntary pledges at this during this review. For example, they pledged to have a national action plan on human rights. We believe this would go a long way in addressing human rights issues. They agreed to establish a cabinet subcommittee on human rights and an interministerial technical committee and a human rights desk in the Ministry of Justice, and they agreed to mainstream human rights education. And they adopted several recommendations where they agreed to domesticate international standards, enhance separation of power, increase accountability, eliminate safe houses, among many other things.
Roselyn, I'd like you to talk to us a little bit more later about this public, this right to assembly, walk to work and other things. But first of all, Roselyn, Patricia, what are some of the key health indicators when you talk about right to health, right to education, right to housing? What are the minimum standards that you're looking at?
For each of the rights, what we call the minimum core obligations.
Yes.
So if you're looking at an issue of health, which will be maternal, you look at your basic, you look at maternal mortality, what is being allocated to, what is being allocated to that specific area in form of money, in form of, if you're going to do any budget analysis, you look at your minimum health care package, what it contains, primary health care, prevention and control of endemic diseases, something like Ebola and etc. Those are what we call the minimum, or what a government is entitled to. And
they're not doing this. So people come to you and complain.
It's not very, very good. If you're looking at education, you're looking at UPE and USE, you're looking at the quality of education that's being provided to, in form of funding, what's being provided. You'll be able to even assess the quality of education. You look at funds allocated to special needs children, special needs in schools, and that was very limited. What are the material conditions of work of teachers? That is in regard to education. If you're looking at housing, you look at how much has been allocated to the housing sector.
They are supposed to build us houses?
No, not necessarily build houses, but the conditions is supposed to avail. Is supposed to.
At least they give you cement, you buy the sand.
No, the thing is, if government says we can't provide low-cost housing at this and this in this area, or which are people.
Build those flats in Bukuru. Maybe you haven't seen them. Media means.
But they have been privatized. If you look at the chapter on right to adequate housing, and when we're discussing, we note, yes, there was the flats were built. There was a condominium act passed. People were able to acquire those properties, but when you're dealing with these issues, you're looking at the vulnerable, the poor of the poor. Now, can the urban poor?
They can't fit.
Could they be able to purchase?
But how can the government help the people in the villages?
Could. Now we have to look at the right to adequate housing. In this report, we dealt with it in form of rural-urban migration. So we're looking at the context that people are moving from the rural areas
to the
urban areas. So what is happening in the urban?
What is the government supposed to do? Provide water in the slums?
The government we look at the policy. What policies have been put in place?
What are they supposed to deliverables?
What laws are put in place? Okay. Now, if they put a policy or a law in place, maybe to protect occupants in a certain land, but you have to look at the issue that came out is the complex land tenure system. So even in those places, you have a complex tenure land system.
Other countries have just one.
Yeah, other countries have just one. So that's an area of
they should address that.
Then they put in place what has been debated over time is a national land policy.
Yes.
And that policy would guide what type of ownerships are in A,
available.
or B,
right.
or C.
Maybe have one uniform law.
The other issues are what services are being offered in these places, if it's water, if it's education. So that is in form of a right to adequate housing. So those we make recommendations, and we thought that government should not only be a regulator, because this is a sector
they should be a provider to
this is a sector sector that is met by demand and supply and is private.
All right. Let's talk about, does the government take your recommendations here? Because I'm about to come and lodge a complaint. I don't have the internet. I don't have an internet hotspot in my house or even in my garden. I can't go out and surf the internet. And yet the internet is a human right. I'm going to come and complain. Can't sit on the tree and surf.
That's laughable.
How does the government take your recommendations? Does it take them seriously, or it's just another book on the shelf?
When we assess recommendations, we assess them on either they have been fully complied with, partially complied with, or not complied with at all. In 2011, 77.5% were partially complied with,
yes,
compared to the 72% in 2010, while 22.5% were not complied with at all. So assessment is made on those grounds. So to be able to note how far has government gone. When they pass the bar, we'll say they have been fully complied with.
Are they compliant right now? Do they? What mark would you give them right now?
When you're looking at the criteria, I'd actually say they're on the whole, I think they've done fairly well.
What percent?
60%. If you're looking at the criteria and you're looking at what has been partially complied with, because some recommendations are will take legislative measure, policy measures, budget allocations. So your assessment has to take
You're
that.
trying to defend them.
No, you have to listen. It's not that I'm defending them. Your assessment takes into place. You say, okay, we've said we want a law in place. What has been done so far? We say we want budget allocations to this sector. All right? Has this improved or it hasn't?
What mark would you give them overall, taking into account all those mitigating factors?
If you say 77.5%,
government is doing very well.
77.5%.
77.5%. Bigger than the electoral majority.
It's full and partial.
Well,
thank you.
Let's talk about Roselyn. Let's talk about this walk to work, the right to assembly. The government says 3 is a crowd. Is that really something that's agreed? What have you told them?
We've gone section by section of the public order management bill. We of course concerned about the kinds of restrictions being raised on the public order management bill. Particularly, I believe it is section 5, which limits the number of people. But it's not so much the number. I don't think I'd be so concerned about the number.
If you're going to invite people,
it's more the.
Tell us how many you invite.
Yes, no, it's more
demonstration or rally.
It's more. It's really more about the kind of restriction that it puts on expressing opinion, and that is a major concern. The way the bill provides it is very prohibitive, which is disturbing. For example, the meaning of a public meeting is a gathering of these people, of 3 or more persons in other places, and it is for when they are expressing, opinions on policies, on actions of government, and that is really restricting freedom of expression. The way the law puts it is in a way as if you're not allowed to talk. Correct. I think people are allowed to talk. And people are allowed to criticize, of course within the proper limitations and things like that. But you can't just prohibit that kind of expression and assembly and things like that.
Let's talk about electoral democracy. Katongole in Rubaga was sworn in, he was gazetted very, very good overnight, maybe in the middle of the night. Then they saw him in at full speed before his turn come. The other man, Kasiwante, has not even been sworn in. Is that an abuse of his rights? Or is that those are things that it doesn't appear in the report?
This report didn't cover that. It covered the general picture on elections. I think by that time, those are new developments.
Which I haven't looked at.
Post elections. I don't know whether you want to hear about what we found during the elections.
Give us some parallels, maybe.
We found that the EC seemed better equipped than in the past, used innovative technology, increased publicity, there was an increase in number of voters, increased countrywide representation of some political parties, which was good. Those were the positives. Among the challenges, we found a negative perception of the Electoral Commission, of course, affected its work. Nearly all the political parties expressed mistrust and suspicion. There were challenges in election administration, in the implementation of electoral laws. There were challenges in the role of media. Guidance for them came late, but some of the media houses exhibited discriminatory tendencies towards
opposition.
Some political
blocking
parties.
the radio stations and going away when they're supposed to host an opposition politician.
Yes, yet in some instances they had already paid for the service.
Right.
There was insufficient voter and civic education. There was challenges in special protection for vulnerable groups who could not come and vote. There was, of course, some election violence, and the dissatisfaction of political parties with the results was a challenge. And we make recommendations to address these challenges.
And when you talk about finance and administration, what do you mean?
We're talking about our finances, who gives us what?
The money that you get.
The money we get
for the commission.
Of course, we have.
How do you like it to be?
We would want more.
Go on.
We would definitely want more so that we can be able to carry out our core functions. We get our budgets from the government of Uganda and from development donors. In 2011, 65% was from the government and 35% was from donors. Of course, we would want more from the government, which has an obligation, of course, to provide what we need to effectively carry out our functions.
And human rights education and outreach, what do you mean by that?
We carried out various human rights education
You want to
activities.
sensitize us on all our rights, including the right to internet in the compound. Go on.
It's not clear whether you really have a right to internet that you can
you
demand
can
against
UN.
the state. I think that you're following the advert of MTN, which is...
Well, the United Nations policy is a human right. I am entitled to the internet.
It's not necessarily that way, but we'll discuss that another day. But we did carry training programs for local leaders, grassroots communities, district officials, district human rights committees, human rights clubs, religious leaders, and media, among others. We conducted publications, radio talk shows, television programs, sport messages, meetings, including workshops and conferences and barazas. Of course, we note that in spite of all that we did, it was inadequate. It's not about the salaries. It's about actually effectively reaching the citizenry and teaching about their duties and obligations and their rights. So, of course, we can't say that we were effectively able to cover. And also, we found challenges in terms of the Constitution. I think it should be. We recommend that it should be translated into more local languages.
Will people find it relevant?
Yes, I think they will. It's a very empowering document.
Well, let's give a copy to every LC1 or something like that.
Not just the LC1, I think every citizen ought to have a copy so that they know their duties and obligations and responsibilities, but also their rights that they are entitled to claim against the state.
Let's hear from the listeners. Dear listeners, this is Spectrum on Radio 1. Tonight, Uganda at 50. What other key human rights issues? Looking at the findings of the Uganda Human Rights Commission in its latest report. You can call in now. Our numbers 0414 348 111, 0312-260-390, 0312-261-390. When you call in, please tell us your name and where you are calling from. Talk to us about this universal periodic review. What exactly do you mean by the universal periodic review, Patricia?
The universal periodic review is a review done by peers at the Human Rights Council. They review. Uganda is a member of the Human Rights Council, so they review all members of the Human Rights Council on new obligations. So Uganda went through that review. They looked at our obligations and what the state was actually implementing. Civil society made reports.
Okay, I'll interrupt you there so we can hear from one of our listeners. Spectrum, hello. Say your name. Can you switch off your radio or walk away from it? We can't hear you when you speak. There's a radio feedback. Can you say it again? Your name? All right. Well, our number is 0414-348-111, 031-226-0390, 031-226-1390. When you call in, please switch off your radio or walk some distance away from it and tell us your name and where you are calling from. I'm not sure if you got the details because the radio is giving us feedback. They're continuing talking to us about the Universal Periodic Review.
So the civil society made reports, the Uganda Human Rights Commission sent a report to the council, and the state made a report on the implementation of its obligations. It presented this report, and thereafter delegations made statements and raised concerns on different human rights issues that concern the country. So various delegations made comments on Uganda's what they perceived as Uganda's achievements and challenges, and made recommendations. The recommendations are captured in the report. Most of them were adopted by Uganda. Some were not adopted, and some were considered later this year and are going to be taken on by the state. And as my colleague Roselyn says, one of the most important recommendations is to adopt a national action plan on human rights. What do you plan to do in the next 3 years?
Let's talk about it. Let's talk about the National Action Plan on Human Rights. If you had to give the government a to-do list for the next 1 to 3 years, what would you give them, Roselyn?
For a start, adopt the human rights-based approach in terms of conducting business. In whatever government undertakes, it must promote the human rights-based approach. If development is looked at from that angle, because human rights is linked to development. If you violate human rights, you affect development in many ways. Why? A conflict can arise, and during conflict sometimes there's loss of lives, destruction of property. So it would be great to kind of embrace and adopt this human rights based approach. It would be nice to review all the laws that we have that are not compliant with international human rights obligations and address them. There are concerns which have been raised by the Human Rights Commission, by civil society working on human rights issues, by other stakeholders during this review. It would be great to have a plan and say we shall address this year. Maybe we'll adopt laws, maybe we'll adopt regulations, or maybe we will do this, or we will train government officials so that we can deliver, or we'll avail more resources for that. So that's the kind of thing that the plan entails. It would all fit in with our national development plan, but this would be particularly directed at enhancing human rights observance and respect.
All right, listeners, this is Patricia on Radio 1. Our topic tonight, Uganda at 50. What are the key human rights issues? Looking at findings of the Uganda Human Rights Commission in its latest report. The lines are clear right now. You can call in 0414-348-111, 0312-260-390, 0312-261-390. Take us deeper on the National Action Plan. What you would expect the government to do going forward?
Going forward, I expect the government to look at all the recommendations, especially those that were adopted and are not in dispute, to go through them thoroughly. For example, there were concerns raised about the death penalty. There were concerns raised about the use of excessive force by security agencies. There were concerns raised regarding restrictions to freedom of assembly and expression. Those kinds of things need to be addressed. There were concerns regarding a lack of law criminalizing torture and other ill treatment. We would be happy to have, we are happy that the law has come. I think that the strategy would be now how to get it, if it's assented by the President, the strategy would be on how it can effectively be implemented. We believe this law is important because it would enhance individual accountability and maybe reduce some of the torture and ill treatment that has been meted out by security agencies. So those are some of the things that would look out for, but it would have to be done in a consultative manner.
Yes.
The government would have to reach out to the communities and identify what are their greatest needs. Of course, there are people who are concerned basically with civil and political rights, but out there, most people, they are being affected by poverty. They cannot afford the basics of life, healthcare, shelter, housing, food. I think that many people will be interested in that, and it would be great for the government to address those concerns. If you analyze the strikes which we listed, the strikes, demonstrations, and name it, they were all for economic reasons. It was either unemployment, poor pay, electricity, it was really socio-economic issues, and I think that those would have to be addressed. But whatever government would do in this National Action Plan would have to take a very consultative process.
All right. Patricia, again about health, there was a report the other day that lots of medicine get wasted at the head office when people from the districts cannot come for them because they prefer cash. Is that abuse of human rights or not?
What the commission noted is the system.
Or maybe they should change this and they give them cash to buy what they want.
They would have to agree, because there's been an argument that the system is not working, the push system and the pull system, where things you have to requisition and get
from the center
that is not working, doesn't respond to the needs at the different health centers. There's an argument, a cross argument that comes from the center that says we actually respond to your needs. So I think there's a need for the two to work closely together, because they may not be a very fine way to address it, but maybe the two need to work.
Maybe it's over-centralized.
The two need to work. It could be over-centralized. What could be procured maybe from the district.
Or they could have regional centers. They have regional currency centers.
Yes. So they would have to see a way to work together, because it's a complaint that is coming out as a concern. Even
and a lot of drugs are wasted here, and people need them in the villages.
There's that.
People are dying. They're actually dying in the villages.
Yes.
If you're in the capital, you won't realize it.
That has been pointed.
People in the villages die. The drugs rot in the capital.
Yes. So there has to be a way, and for the two to sit down and forge a way forward. I think most of the solutions are found with us. The people who have used the system, the people who are in charge of the system.
Well, but they might take the money for drugs and pay themselves allowances.
There's a need to have a connect, as she was saying, between the health centers and
this center, the NMS, the National Medical Store,
and the National Medical Stores, such that the needs are met at the health centers, and really
so
there should be no reason. But the drugs are sometimes purchased collectively in bulk. It's cheaper that way, so they have to resolve it. They have to find means of resolving administratively.
Well, this is Spectrum on Radio 1. We have to go. Thank you very much. And I must apologize for you who might have tried to get in and could not. That problem is going to be resolved by the time we get back here tomorrow. There was an apparent fault in those lines. But I must thank our guests, Mrs. Roselyn Karugonjo Ssegawa, Director of Monitoring and Inspections at the Uganda Human Rights Commission, and Ms. Patricia Nduru, the Head of the Rights to Health Unit at the same Uganda Human Rights Commission. Thank you for tuning in. I've been your host, Edmond Kizito. Spectrum will be back tomorrow. Up next is the news in English. Stay tuned.
Everybody is a star, but some stars shine brighter. Oh yeah, be a standout, be the star now and let your light shine through.
Uganda Communications Commission is celebrating initiative and originality in the communications sector with the annual Communications Innovation Award, ACIA, on the 18th of May 2012 at the Kampala Serena Hotel. The occasion will be graced by Vina Rawat, Vice President of BlackBerry. ACIA 2012, making life easy through innovation. Open an ice-cold Nile Gold, but don't drink it just yet. Take a closer look. You'll see the rich golden color. Get closer still, and you can't miss the fresher aroma. But you'll also find something else. You won't see it, but